Hi, my name is Chris Winterode. I work for the New Mexico Aging and Long-Term Services Department. I'm the SHIP and SMP Program Manager, and I'm here today to give you some information about how Medicare works with Indian Health Services. Bear with me for just a moment while I get my PowerPoint up here. There we go. So we're going to talk today about how Medicare works with Indian Health Services, and we're going to start with a little background on the Indian Health Services. First of all, we want to acknowledge that this land we're gathering on is that of the ancestral lands of New Mexico indigenous peoples. As we gather today on stolen land, we want to recognize the continued need to give support and honor all the inhabitants that now call New Mexico their home. We ask that everyone come together in a loving and accepting spirit to improve this community for all and show due respect in caring for all its people, especially our elderly and disabled ones. And in the spirit of this land acknowledgement, I want to recognize up front that what I've done in this presentation is use the language to refer to American Indian and Alaska Natives that's accepted in Medicare and Indian Health Services and Centers for Medicare and Medicaid documentation. I understand that that may not be the language that's preferred in a particular community. And when I go out and talk to people in their community, I always ask how they like to be referred to. But in this case, since it's a general presentation, we're going to use that established language. Please know that I mean it with the utmost respect. So we're going to talk a little bit about Indian Health Services. A special government-to-government relationship is established in the Constitution of the United States. It's encoded in the Constitution, Article 1, Section 8. This has been continuously reaffirmed through a series of treaties, laws, Supreme Court decisions, and executive orders since it was first established through up into this century. Indian Health Services, or IHS, is part of the Federal Department of Health and Human Services, and it's tasked with providing health services to American Indians and Alaska Natives. American Indians and Alaska Natives are steadily growing older. Many American Indians and Alaska Natives with disabilities need care. Statistics show that there will be 2.5 times as many AIAN elders by the year 2030 as there were in 2012. It's a rapidly growing part of the community. More than 50% of American Indian and Alaska Native people are age 65 or older have a disability. 1 out of 3 of AIAN adults with disabilities is in need of care and younger than age 65. American Indians have a lower average life expectancy than the general population and higher rates of many health issues. There are disparities in the access to health care and amounts spent on health care that contribute to negative health outcomes. On the Indian Health Services website, the closest comparison that they had was the 2019 per capita personal health care expenditure for IHS users was $4,078. In comparison, in 2017, which is 2 years earlier, the US national average was $9,726. So in general, less than half the amount is spent on healthcare for American Indians and Alaska Native population than for the general population in the country. So this is clearly a really big issue. Medicare, Medicaid, And some of these benefits can help bridge some of that gap and hopefully help improve healthcare outcomes for AIAN elders. So, how does Medicare work with Indian Health Services? Medicare is generally for people who are 65 or older, people who are younger than 65 with certain disabilities, and people with end-stage renal disease. So you can see that it may slot right into some of those gaps that we just discussed. How do you get enrolled in Medicare? If you are already collecting your Social Security retirement check when you turn 65, you'll be automatically enrolled and you don't have to do anything. If you're not collecting that Social Security retirement yet, or you don't qualify because you have not paid into the system for 40 quarters, then you may need to actively enroll online at ssa.gov or through your local Social Security office. Oops, go back. The initial enrollment period begins 3 months before the month you turn 65, continues through that month, and for 3 months after. So you have a 7-month period to do your initial Medicare enrollment. If you don't enroll when you're first eligible, you may owe late enrollment penalties if you enroll later. Many people that I work with in the American Indian communities and the Pueblos and Indian nations that we serve may not have enrolled in Medicare Part B when they first became eligible because it's not free, right? And they figure, if I already have healthcare through Indian Health Services, why should I pay a premium to get this additional Medicare coverage? And we're going to talk about that more throughout the presentation, as well as some ways to avoid that late enrollment penalty, even if you didn't enroll during your Medicare, your initial enrollment period. So what happens if you missed your initial enrollment period? Every year, there's a general enrollment period from January 1st through March 31st. That's when you can enroll in Medicare if you didn't enroll during your initial enrollment period. If you enroll during that time, your Medicare Part B will become effective the first day of the month after you enroll. The penalty, the late enrollment penalty, is 10% for each full 12-month period that you did not have health insurance. Indian Health Services is not an insurance. It's a health benefit. It's a federally guaranteed health benefit, but it is not an insurance, and it doesn't work the same way as an insurance does. If you qualify for a Medicare Savings Program, or MSP, penalties will be waived and you can enroll in Medicare outside of regular enrollment period. That is a great way to get your full Medicare benefits without having the extra costs associated. There are a number of special enrollment periods where people can enroll in Medicare. If you move out of your current plan's service area, if you already have Medicare and you move, you get a special enrollment period at that time. If you lose employer coverage and you are in a Medicare eligible either by age or disability, then you have a special enrollment period. If you're impacted by a disaster or a declared state of emergency, which unfortunately here in New Mexico we've experienced a number of times in the last few years, you have a special enrollment in that case. If your health insurance plan or your health plan or employer made an error and provided incorrect information, you have a special enrollment period at that point. When you're released from incarceration and you're Medicare eligible, you have a special enrollment period. If you lose Medicaid, and right now there are a lot of people in this situation with the Medicaid renewal situation post-pandemic. If you lose Medicaid and you are in a Medicare eligible category, you have a special enrollment period. And there are other exceptional conditions as determined by Social Security that may come up. So what are the Medicare basics? Medicare has a number of parts. I like to think of them as building blocks, and depending on the way you put them together, it's going to impact the way you get your care. So Part A is hospital coverage. It covers inpatient hospital care, skilled nursing, nursing home, hospice, and certain home health services. The way home health services are defined under Medicare Part A is very specific and is along the lines of skilled nursing care delivered in the home, not personal care services. If you or your spouse has worked at least 40 quarters and paid Medicare taxes, you qualify for premium-free Medicare Part A. If you aren't eligible for premium-free Part A, you will have a monthly premium. However, if you qualify for a certain Medicare Savings Program benefit based on your income, you may have that penalty waived. Medicare Part B is the next block. It's your medical insurance that covers doctor visits, durable medical equipment, treatment ordered by your doctor, and preventive services. The standard Part B premium for 2023 is $164.90. And at this time, the time of this recording, I don't know yet what it's going to be for 2024. They haven't released it. Depending on your modified gross monthly income, your premium may be more. There's what's called an income-related Medicare amount that for people with a higher income, they may pay more. It's like Medicare's sliding scale. Those who can pay more are asked to do so. There is also what's called a hold harmless clause, so that those who are low income actually aren't subject to premium increases. So there are some variations in what you may pay, but most people pay the standard premium. If you're low income, you may qualify for a Medicare Savings Program, which pays the Medicare premium for you so that you can have the full Medicare benefit without the extra costs associated. There's a lot of data that shows generally in just the general population of the United States, the Medicare savings programs are way underutilized. There are a lot of people who could be getting this assistance who haven't applied. And within the Native American, American Indian, Alaska Native communities, that certainly holds true as well. The third building block is Part D, prescription drug coverage. And prescription drugs are included based on the plan's formulary. Each plan has a different formulary and may include different drugs. That's their list of covered drugs. They also have a wide range of premiums. So there are a lot of prescription drug plans available. Our New Mexico SHIP program helps people sort through those. We offer free, unbiased, expert information and assistance to help navigate through this landscape of options. Plans include different preferred pharmacies, and this has a big impact on your copays, which are, your monthly costs when you pick up your drugs. You may still use your Indian Health Services or Indian Health Clinic pharmacy to pick up your drugs, and you won't have the copay in that case, and Medicare will be charged. This is excellent for the Indian Health Services budget because what it means is they're not covering the full cost of the medication. They're really only covering your copay, and the rest they charge to Medicare. So this is maybe not a direct benefit to the Medicare beneficiary, but it's a big benefit for the community. You may qualify for extra help from Social Security, which helps pay pay monthly premiums and copays for prescription drugs. If you qualify for a Medicare savings program, you'll also qualify for extra help, and one application goes through for both of those benefits. The next, taken together, Medicare Part A, B, and C is what we refer to as original Medicare. For most people who want to continue to get their health coverage through their Indian Health Services clinic, this is probably going to be the best configuration of Medicare, because your Indian Health Services clinic will just bill Medicare for your care. It's pretty straightforward. The other way to get your Medicare is through Part C, or a Medicare Advantage plan. Medicare Advantage plan bundles together your Part A hospital coverage, your Part B doctor coverage, and usually, but not always, includes a Part D prescription drug plan. With a Medicare Advantage plan, you're going to be required to get your care within that plan's network in order for your services to be covered. So it's extremely important, if you want to continue to get your care through your IHS clinic, that you check with them to see if they accept that particular plan if they're in network. Many times they may not be. Right. And so here in our New Mexico SHIP office, we are frequently helping people sort out that situation, because a plan may or may not have, encouraged the Medicare beneficiary to make sure that they'll be able to get their care where they want using that insurance before they sign up. So in that case, we can always help people sort that out. People are attracted to the Medicare Advantage plans because of the additional coverage that they offer, such as dental, vision, and hearing. And often there are other perks. The big thing that is drawing people right now are these flex cards that many of the plans offer, that they'll give you like a debit card that you can use in whatever way you choose on pharmacy items, for groceries, a variety of ways. One of the things that we caution people about before making an important decision about changing their health care coverage is making sure that they're still going to be able to get the basic health care coverage that they need the way they want it. Sometimes those additional bells and whistles and perks aren't worth it if it means you can't see your preferred doctor anymore or have to travel a long distance to get your care. So this is a very important thing to consider before making any changes. Medicare Advantage plans may charge an additional premium, which would not be covered by the Medicare Savings Program if you have one. And again, we've already discussed how important it is to make sure that the doctors that you want to continue to see are in network for the plan that you choose before you sign up for it. So why? Why would you want to enroll in Medicare? As we've already mentioned, IHS is not health insurance. It's a part of the federal government that delivers health care to American Indians and Alaska Natives and provides funds for tribal and urban clinics, but it's not an insurance. Medicare is health insurance, and it increases your options for treatment and care. You have the option to go to the doctor of your choice that accepts Medicare. So perhaps you have a health condition and you want to go to somebody outside the IHS network. You would be able to do so if you have Medicare, and it would be covered. It also protects the resources in the IHS system. Yes, it is part of Health and Human Services, but as we already discussed, the funding available is, it works out to less than half of the national average. And so any resources that can be preserved within that IHS budget allows them to expand, enhance services, and help more people. It also means that you have more resources at your disposal at your disposal to support your health. How does Part B benefit you? A lot of the people that I talk to here in New Mexico have Part A because it was free and may have declined Part B because they didn't want to have to pay an additional premium, and maybe they weren't aware that they could apply for a Medicare savings program which would pay that premium on their behalf, enabling them to have Medicare without any additional costs. How would it benefit you to enroll in Part B, even late? It expands access to primary care providers and specialists outside of the IHS system. You can get covered services without having to go through the IHS purchase referred care authorization process. You can get covered healthcare services when you're away from home. It can be complicated if you're away from your home area to have your care covered at an IHS clinic. And you may be responsible for care received outside the IHS system if you're not in your home area. And if you enroll when you're first eligible, you can avoid that Part B late enrollment period. Please don't let the Part B late enrollment period stop you from considering enrolling now, because if you're under, I'm going to just throw out around $2,000 a month in income, you're likely to qualify for that Medicare savings program that will pay the Part B, that will waive the Part B late enrollment penalty for you. Why is it good to enroll in Part D? There are also a lot of people that we work with who've said, I get all my drugs through the IHS clinic. Why should I enroll in Part D? Because there will be a premium. If you qualify for extra help, that premium will be waived. But if you're over income for extra help, then you're going to be paying a premium for your Part D plan. Part D plans expand access to medications that may not be approved or available through IHS. So you're going to have a greater choice in the medications that are available to you. You can get medication covered after hours and on weekends when the IHS pharmacy is closed. It just simplifies, if you have a health emergency on the weekend, your ability to get your prescribed medications quickly. Again, when you're outside of your clinic area, it simplifies getting your medications when you're away from home. And you won't have a Part D late enrollment penalty. Again, just like with Part B, if you don't enroll when you're first eligible, there may be a penalty. Getting your medication through the Indian Health Services clinic is considered creditable coverage. And if you can show that during the time that you didn't have a Part D plan, you were getting your medication through your local IHS clinic, you won't have a Part D late enrollment penalty. If you need help navigating this process, again, your local SHIP, our New Mexico SHIP here, can be reached at 1-800-432-2080. We're happy to help you with that process. How does Medicare benefit Indian Health Services? It really is a great benefit to the community if people who are eligible for Medicare are enrolled. Indian Health Services is the payer of last resort. And what that means is what they want to do at your IHS clinic is charge every other possible payer before they pay. And again, it's about preserving the resources in the system so that they can serve more people, make improvements, and provide better care to the community as a whole. So your IHS clinic is going to want to bill Medicaid if you're eligible. They're going to want to bill Medicare for your care if you're eligible. So definitely talk to the staff at your local IHS clinic to see if they can help you identify what benefits you're eligible for, because they have a strong interest in helping people get access to every benefit that they're eligible for so that they can improve and extend their services. The IHS budget only meets about half the need, and that's even separate from the cost disparity on personal health care that we discussed earlier in this presentation. And so it's very, very important to help people connect with as many benefits as possible, both so that they improve their own access to healthcare and healthcare outcomes, and to support the Indian Health Services ability to meet the needs of the community. So we've mentioned a number of times Medicaid and the Medicare Savings Program. We're going to talk a little bit more about what those are and how to access them. So Medicaid is a federal and state program. Medicaid assistance for people is assistance for people with limited income and resources. It covers about 74 million adults and children. There are 68 million individuals enrolled in Medicaid, and SCHIP, or CHIP, is the children's program, Children's Medicaid, and I cannot remember the alphabet soup of SHIP, SCHIP, but there are about 6 million children enrolled. Medicaid also helps with Medicare costs for more than 10 million dually eligible people. And that's people who are enrolled in both Medicare and Medicaid. You may be enrolled in either a partial Medicaid, like the Medicare Savings Program, or a full Medicaid program, like the Home and Community-Based Waiver or the Institutional Care Waiver. So what are the Medicare Savings Programs that I keep talking about? They're Medicaid administered programs that are designed to help make Medicare affordable for elders and people with disabilities on a fixed income. They help cover Medicare premiums and cost sharing for those with Medicare who have limited incomes and resources and no longer qualify for full Medicaid for whatever reason, usually because they have a full insurance coverage through Medicare. How do MSPs help? Medicare is the primary health insurance for seniors aged 65 plus and many younger adults who are receiving Social Security Disability Insurance or SSDI benefits. Once you've been on SSDI for 2 years, you are going to be automatically switched over from Medicaid to Medicare. This can be quite a difficult transition for people. Our SHIP program, State Health Insurance Assistance Program, can help you navigate that and make sure that you have applied for all the benefits that you need to make that transition as easy as possible and avoid gaps in coverage and care. So please do call us if you are in that situation. Medicare isn't free. It was not designed to be free. Generally speaking, Medicare covers 80%, and the Medicare beneficiary is responsible for the other 20%. Out-of-pocket costs, that 20% for premiums, deductibles, co-payments, and co-insurances adds up. And for people on a limited income, that can create a real financial and healthcare challenge. So that's where the Medicare savings programs come in, because depending on the level of benefit you qualify for, which is based on income, it will cover at the very least the premium, which is $164.90 a month. And it may also cover your deductibles and co-payments, meaning that you would have no out-of-pocket costs for your care. So we really don't want people to not be able to get the care they need because they can't afford it. So if you're in that situation, you absolutely need to give us a call and we'll help you apply for a Medicare savings program. So as I mentioned, it's there to make Medicare affordable for those who qualify. Also, depending on the level of benefit you qualify, it may waive or eliminate that Part B late enrollment penalty. It also gives you more rights to change your coverage. People who have a Medicare savings program can change their Medicare coverage quarterly rather than having to wait for the Medicare open enrollment period every fall. So the levels of Medicare savings program benefit are qualified Medicare beneficiary, or QMB. This level of benefit is associated with the lowest income, and I don't have the income limits on here, but I will have them available at the in-person section of this workshop so that you can check to see if you or someone that you know might be eligible. So with QMB, it pays the Part A premium. So if you don't qualify for free Part A because maybe you worked in a traditional occupation that didn't pay in to the into the payroll taxes that make you eligible, this might be a good way for you to be able to get that without having to pay the premium. It also covers the Part B premium, and it waives any penalties. It pays your Part A and B deductibles, co-payments, and or co-insurances. So it is a great benefit. If you qualify for QMB, you're going to be able to get your full Medicare benefits without any out-of-pocket costs to you, even if you didn't enroll when you were first eligible. The next level of benefit is specified low-income beneficiary, or SLIM-B, as we call it. It pays only your Part B premium, and it waives late penalties for Part B only. So if you don't qualify for premium-free Part A and your income is such that you qualify for SLIM-B, it's not going to waive the Part A penalty for you. Oops, sorry. The next level of benefit is qualified individual, or QI1. Again, this pays, just like SLIM-B, it pays only the Part B premium and those penalties. This is different from SLIM-B in that it's a block grant, meaning that there's only a certain amount of funding available, and once that funding is gone, no more people are going to be able to qualify for it. So it has a higher income limit. Okay, what is great? I'm just going to say the MSPs are great, right? It is our mission in the New Mexico ADRC SHIP and SMP programs to help as many people as possible connect with these, because there's really no downside. What do they do? They waive your Part B late enrollment penalty. Sometimes people, I've talked to people who've hesitated to apply for an MSP because they worry about estate recovery. They've heard about Medicaid estate recovery. For MSPs, they are not subject to estate recovery. And that means states are not allowed to ask for repayment of the costs that they covered under the Medicare Savings Program from the estates of deceased recipients, right? So you do not have to worry about that. That is not a thing for Medicare Savings Programs. And if you get an MSP, you're also automatically going to get the low income subsidy, or extra help, which is a Social Security program we discussed a little bit before, that pays for, helps pay for prescription drug costs. If you qualify for an MSP, you're automatically deemed eligible, and you're going to get extra help with your prescription drug costs. Also, as I mentioned before, people who are enrolled in MSPs have additional benefit that the general Medicare population does not have, to change their Medicare coverage quarterly. Right? It's a great additional right for people who qualify for this benefit. Other Medicaid programs that are really important are the Medicaid waivers. Some Medicaid waivers are tailored to particular needs such as mental health, developmental disability, or medically fragile. There are chronic condition waivers that that are for specific situations. Waivers are the main way home and community-based services are delivered and funded. And by home and community-based services, we're talking about in-home caregiving and personal care services, that additional support that helps someone with challenges, health conditions and health challenges, be able to remain safe and healthy in their own home rather than having to go to a nursing facility. There's also the institutional care waiver for people who do need to be in a skilled nursing facility. So when you qualify for one of the waivers, you're going to be getting your benefits administered through a managed care organization. Most people must choose an MCO to manage their benefits. The managed care organization provides a care coordinator and handles the home care staffing and budget for the home and community-based waiver, for example. The care coordinator is a great advocate. We often work with people who are having a variety of kinds of challenges and issues, and reach out to us at the SHIP program or the ADRC. And if there is a care coordinator available to partner to help advocate and locate resources for people, that is always a huge help. American Indians and Alaska Natives can choose exempt and manage the benefit themselves. That's also an option. When it comes to Medicaid, there are asset and income exclusions for American Indians and Alaska Natives. The following are not counted when determining eligibility for Medicaid and or Medicare savings programs. Here in New Mexico, we don't have any asset test for the Medicare savings program. Medicare savings program eligibility is based on income alone, and we don't even look at any documentation about assets. But for the Medicaid waivers, the institutional care waiver and the home and community-based waiver, assets are part of the eligibility process. So if you're applying for that type of benefit, it's really important to know that Indian trust income is not counted as an asset. Neither is individual Indian money accounts, real property within reservation boundaries, natural resource interests within reservation boundaries, and items of traditional and cultural relevance. None of those can be considered as assets when determining eligibility for Medicaid. So at the end of the presentation, I always like to ask people when I'm working, especially in, a tribal community, what I missed. What did I leave out? What are some pros and cons that you've thought about when determining whether enrolling in Medicare is right for you, or in, any aspect of your healthcare insurance or health coverage? So this is the starting point of the discussion that we'll have in the live portion of this workshop. So I'm going to turn off the camera now, and we're going to start talking together in real time. Thank you so much.